as I set out on slide 6, there are a number of things as part of our kind of winter resilience planning that we had put in place, including an increase in beds, particularly across the Charing Cross and at St Mary's, the reallocation of some of our senior staff and our emergency nurse practitioners from the Hammersmith EU into both the Charing Cross and at St Mary's, as well as a number of actions that we put in place around additional therapy staff, some additional imaging capacity, so diagnostics like CT, MRI scanning for the winter period. Now, clearly we're not delivering the performance, so it has not been sufficient in terms of what we put in place. But there is a significant amount of planning that goes in because winter does come every year, and we know that there's a seasonal variation in the level of attendances and admissions that will come into our hospital. The additional things that we're putting in place, so the additional consultant staff in the ED, the additional physicians that Bill had talked about, the additional capacity in terms of how long that's going to be in place, well, all of those things that I've just mentioned, particularly the senior staff, are substantive. They're being appointed on substantive contracts, and that will be a permanent increase in terms of the senior decision takers that are available within the emergency department and within acute medicine. There is a level of seasonal variation, so we will be looking at whether we can reduce the bed capacity at a certain point as we go from March, April into May, June and into the summer period. But we will be planning based on what we've learnt this year to be able to set that capacity back up again and at a point where it is in line with the increasing demand that we're going to be seeing again next winter.